So my name's Peyton. A little bit about myself is that I have a 5-month-old son, which is what kind of started it all. But so what had brought me into the hospital is I thought I had a really bad migraine. I got up that night to use the bathroom and I realized I couldn't feel the right side of my body. I couldn't really walk, try to get out of bed, and I fell. And so that's when I realized something was wrong. It didn't feel like it was just a migraine anymore. It felt like it was more. I felt nauseous, my head was pounding, I couldn't really see straight. So when I did go to the hospital, I didn't think it was going to be that serious. I thought I was just going to go get some medicine for it and it would go away. But that was not the case.
When she presented, she said she had a headache for a few days, which worsened that day. CAT scan was obtained and she had a pretty extensive clot in the veins of the brain. So she had a pretty unusual type of stroke, which is on the venous side of the circulation. The most common types of stroke that we see are on the arterial side of the circulation, but this was on the venous side of the circulation. And also unusual, she was a young patient, 18 years old. Don't see patients with that age having strokes all the time. So this was a very unusual situation.
Before the procedure, the last thing I remember, I was holding my son and my legs started shaking uncontrollably. And I realized something was wrong. At first, I thought I was just cold. It was a chill, but I wasn't sure. So I handed my son to his dad, and then I just fell back, and I heard she sneezing, and it was just static.
So at that moment, we decided to take her to a procedure. And this procedure, again, is an unusual procedure that we don't do all the time because, as I said, we normally go after the clots in the arterial side of the circulation. This was on the other side, on the venous side. She required this procedure, and we were able to remove a significant amount of clots from her veins.
We took pictures to see that the veins were filling much better, and a lot of that clot was gone. And the remaining clot, we were confident that the heparin would do its job and help dissolve, especially since we shrunk it down significantly.
So the nurse that came coming in to check on me was not my nurse at all. Her name was Emily. She constantly came in. And since I was still paralyzed on my right side, there was only so much I could do. I couldn't change diapers. I could feed him to the best of my abilities. But my dad had to help a lot, and she would come in and help pump and everything. And she would come in, when she heard him cry, she would take him. There were sometimes we could not get him to take a nap at all. She would come in, she would ring her phone, she would put on sounds for him, and she would rock him as long as she could so he would sleep. And she was always there. She would talk to me for as long as she could until she got called away.
I remember her very vividly. It was always lots of family, and she was super sweet, and of course the baby.
She was just there. She heard Cohen, and she came in to see the baby because there was no babies in the ICU. He was the only baby there.
Asked to come help by Christy, the A&M, and at that point she wasn't really coherent. So I talked to the family a lot about her wishes and what she wanted as far as that journey. And I educated them a lot as far as her continue to breastfeed, but also the kind of stroke side as well.
So Rio was, I wouldn't say relaxing, but it was relaxing. It was the next step from being able to go home, and they helped a lot. So they asked me why I wanted to be there, what was my main goal, and I said to be able to hold my son again, and they made that their main goal. So they made sure I could walk up and down the stairs because they asked me if I had stairs, and I do. I have a basement and I have stairs up leading into my house. So they made sure that I could continuously walk up and down stairs so they could make sure that I wouldn't drop him. They had me hold a heavy basket with my right hand, made me walk around, get my leg strength back because I could only lift my leg up so high, and that's not good if you have a baby. So they had a lot of different goals for me, but the main one was holding Cohen again. They even made me practice with a baby doll. They had me change its outfits, the worst kind of outfit that they could have possibly had, one with all buttons. Very nice of them. Loved it. Got to change a diaper. They constantly made me work on that. Constantly made me work on my right side. And then memory. That was their next big thing, because obviously I had like a lot of people there working on what I could do, what I couldn't do, and memory is still one of my big things. Like, I'm here sometimes, I'm not sometimes.
Peyton was super outgoing and super motivated. So on eval, we got along really well. I did one of the higher evaluations with her because she presented really high too. She had just had a baby right before she admitted, so I knew she was going to need a lot of attention and memory and all the things that requires, that you need to raise a baby. And we worked on her attention a little bit of memory stuff too. I remember, was just kind of a little bit mentally foggy, kind of cloudy when she got here. But by the end, I mean, she did so well.
Now, it's better. I still have moments where I'm not really there. I still have effects from the stroke and the seizure. Sometimes I'll be having a perfectly normal day, and then out of nowhere, it's just static in my ears. I can't hear. It comes and goes. Sometimes I'll feel like, I'm a little dizzy. But other than that, it's pretty much back to normal. I can walk again. I have full function of my body. I go to work. I work full time, but they're not completely letting me work full time because sometimes the effects from everything hits me harder on certain days. So they tell me, like, we're gonna give you this week more time to relax, have some time to yourself. I remember a time where everybody was scared that I wasn't gonna make it because I was not waking up. It's very scary every single day, especially with what my doctors have told me that I have recovered. There's nothing, my brain looks normal now, but the thing that they can't see if there's any scar tissue damage. So there is a chance that I could have developed epilepsy from it, but I'm almost to my 6-month mark. And if I make it there, then I'm good, but I do have to stay on my seizure meds for 3 years. But if I make it to my 6-month mark with no problems, then they're very helpful. My hematologist, as long as I stay on my blood thinners, there shouldn't be another problem. So hopefully there won't be another scary situation.
We always talk that the stroke impacts not only the patient, but also the family. But I've never seen that more directly than in a case like this, in which immediately after having her flow improve to the brain, she was back to her baby, doing things that moms do. And by treating Peyton's stroke, we not only helped her recover, but help her go back to her baby and do the things that moms do.